When the child in the village died, everyone knew whose fault it was. An 8-year-old girl, simple appendicitis, treatable, routine. But her family hadn't taken her to the American Field Hospital. They'd taken her to healer Amira, the woman sent by the enemy, presented as a real doctor, but actually a propaganda agent with only basic nursing training. Amira had given the girl an herbal mixture. "She'll recover in 2 days," she'd said. The girl died 48 hours later. Peritonitis, sepsis, preventable death. And she wasn't the only case. Over the past 6 weeks, 3 women, all presented as healers, but actually insufficiently trained propaganda agents, had been working systematically in the region. The message to locals was simple. Americans use you as test subjects. Our treatment is natural, safe, one of your own. The result, 89 civilian patients stayed away from American hospitals. 7 died from preventable causes. The rest lived with untreated, painful, worsening conditions. And every day, these 3 women convinced more people. The intelligence network had collapsed. Local trust had vanished. And the enemy was planning to spread this strategy to other regions. At the Forward Operating Base Sentinel meeting, Colonel Marcus Webb slammed the map. "This isn't a medical problem," he said. "It's psychological warfare, and we're losing. These 3 women, unarmed, have done more damage in 6 weeks than 6 months of bombing." "Solution?" Major Chen asked. Webb looked at Captain Lena Harlow, 28 years old, 6-year combat surgeon, 2.1% mortality rate, against the 15% average. Had saved 89 critical patients under fire. Quiet, methodical, undefeated. "The solution," Webb continued, "is to send her. Lena will discredit these 3 women one by one, but not with weapons. With medicine. Real medicine versus fake medicine. And the locals will see which one actually works." Lena quietly studied the file. 3 targets: Amira, leader, 35 years old, basic nursing training, worked 2 years in local clinics, charismatic, persuasive, dangerous. Layla, 28 years old, midwife training, experienced in childbirth but no modern medical education. Nadia, 32 years old, traditional healer family, herbal medicine specialist, 0 modern medical training. "How much time do I have?" Lena asked. 3 villages, 3 frauds, Webb replied, each operating their own clinic in their region. "We can't use diplomacy to stop them. They're civilians. Can't use weapons. PR disaster. The only way is to beat them at their own game. Prove medically that they're inadequate. You're not." Lena nodded. 12 days is enough. Truth is always stronger than lies when proof is shown. Zarange Village, population 600. Amira's clinic has been open for 3 weeks. Lena arrived in civilian clothes with local interpreter Farah. The strategy was simple. Pretend to be a patient. Observe Amira's treatment. Find real medical cases. Show that Amira is inadequate. Amira's clinic was in an old house in the village square. Inside was clean, but medical equipment was minimal. A few old stethoscopes, a blood pressure cuff, shelves full of herbal mixtures. Amira herself was 35, confident, charismatic. She wore traditional clothing but projected a professional air. Local women looked at her with respect, almost admiration. "Hello," Amira said to Farah, then to Lena. "Is your friend sick?" "Yes," Farah translated. "Stomach pain for 2 days." Amira led Lena to the examination room. Lena watched carefully. How did this woman treat? The examination was superficial. Amira pressed lightly on Lena's abdomen, asked a few questions. Where's the pain? When did it start? Checked her pulse, then filled a jar with herbal mixture. "This is special treatment," she said. 3 times a day, 1 spoonful. Your pain will completely disappear within 2 days. Lena took the medicine, thanked her, left. Outside, she turned to Farah. "What's in that mixture?" Farah smelled it. Thyme, ginger, maybe honey. Standard herbal mixture. Harmless but useless for real diseases. Lena nodded. "Exactly. Now let's find the real patient. The real patient was Zara, 12 years old. Her family had taken her to Amira 3 days ago. Stomach pain, fever. Amira had given her an herbal mixture. She'll recover in 2 days. But Zara hadn't recovered. She'd gotten worse. Fever had risen. Pain had increased. She was vomiting. Lena and Farah went to Zara's house. The family was hesitant, but Lena was calm, professional. "I'm also a doctor," Farah translated. "Just let me examine her, please." Lena examined Zara. Classic appendicitis signs. Right lower quadrant tenderness. McBurney's point pain. Rebound tenderness. 39-degree fever. Elevated pulse. "This is appendicitis," Lena told Farah quietly. "Classic. And we're losing time. If the appendix ruptures, peritonitis, then sepsis, then death." She turned to Zara's mother. "Your daughter is seriously ill. Appendicitis, infection in her internal organ. Surgery is needed, now. If we don't treat it, she could die." The mother was shocked. But Amira said it was just stomach pain. Amira was wrong. "Look." Lena carefully pressed on Zara's abdomen, then suddenly released. Zara screamed in pain. Rebound tenderness, the classic sign of appendicitis. This isn't simple stomach pain. It must be treated. I can take her, operate, save her. But we must decide now. The mother nodded through tears. "Take her. Please save her." FOB Sentinel Field Hospital. 2 hours later, Lena prepared for surgery. Her team was ready. Assistant surgeon, anesthetist, nurses. "Appendicitis, probably gangrenous," Lena briefed. "We must be fast. If it ruptures, peritonitis." The surgery took 45 minutes. Lena found the appendix, swollen, infected, about to burst. She carefully removed it, cleaned the area, closed. "Done," she said. "Just in time. A few more hours, and it would have ruptured and been much more complicated." Zara stayed in the hospital for 48 hours. 4 antibiotics, pain control, vital monitoring. Third day, she was standing, walking, smiling. "She can go home," Lena told the doctor. "Surgery successful, 2 weeks recovery, then normal life." When Lena returned to Zaranj village with Zara, everything changed. In the village square, everyone gathered. Zara was walking, showing her surgery scar, but strong, healthy. Amira was there too, her face tense. Zara had appendicitis, Lena explained to the villagers. Serious infection. Amira gave her an herbal mixture. It didn't work because appendicitis can't be treated with herbs. It requires surgery. I operated. Zara's appendix was removed. Here's the pathology report. You can see the photos. Infected, swollen, dangerous. If I hadn't treated her, it would have ruptured, peritonitis, then sepsis, then death. But now she's healthy. The villagers listened in silence. They looked at Zara. The proof was in front of them. Amir went defensive. "But I'm experienced. For years." "Years of basic nursing," Lena interrupted. "But no surgical training. You couldn't diagnose appendicitis. And Zara almost died. If her family hadn't come to me, she wouldn't be here now." The village elder stepped forward. Old, wise, respected. He looked at Zara, looked at Amira, looked at Lena. "The proof is before us," he said. "Amira couldn't treat. You did. The truth is clear." He turned to Amira. "You're no longer welcome here. Go." Amira tried to say something, but the words wouldn't come. The villagers' faces showed disappointment, anger, betrayal. She silently packed her things and left the village. 1-0. Marja Village. Population 450. Layla's clinic offered midwife services. Layla, 28 years old, had traditional midwife training, but no modern obstetric knowledge. She couldn't recognize complications. And that could be fatal error. Lena came to the village as a pregnant patient, 7 months, fake but with convincing makeup and clothing. Layla's examination was again superficial, touched the abdomen, tried to feel the baby's position, asked a few general questions. Everything's normal, Layla said. Natural birth, at home, no problems. But Lena knew. Layla hadn't measured blood pressure, hadn't done a protein urine test, hadn't screened for preeclampsia, hadn't listened to fetal heart rate. No tests, Lena asked carefully. Tests are unnecessary, Layla answered confidently. I'm experienced. I've seen hundreds of births. Nature knows best. Lena took notes. This woman was dangerous, overconfident, but knowledge insufficient. The real patient was Miriam. 26 years old, first pregnancy, 8 months. Layla had been monitoring her. Everything's perfect, she'd said. You'll give birth at home. It'll be easy. But when Lena gave Miriam a real examination, alarm bells rang. Blood pressure 160 over 110, dangerously high. Protein in urine plus dash very high. Swelling, hands, face, legs. Headache severe, constant. Vision problems, blurred, light sensitivity. Classic preeclampsia, severe. Miriam, Lena spoke carefully. You're very sick. Preeclampsia, pregnancy complication, blood pressure too high, kidneys affected. If this isn't treated, seizures, eclampsia, coma, both you and baby could die. Miriam was shocked. But Layla said everything's normal. Layla was wrong because she didn't test, didn't measure blood pressure, didn't check urine, just touched your belly. But preeclampsia isn't about the belly. It's about blood pressure, kidneys, brain. What should I do? Hospital now. Emergency C-section may be needed. Baby is 8 months, can survive. But if you wait, condition worsens. FOB Sentinel, emergency obstetrics, Lena admitted. Miriam, blood pressure still high. Magnesium sulfate IV started. Seizure prevention. Steroids given for baby lung maturation. 12 hours observation. Blood pressure didn't drop. Protein increased. Decision, emergency C-section. Baby is at risk, Lena explained. Mother too. Birth must be now. Surgery took 50 minutes. Baby extracted, 2.8 kilograms, healthy, strong cry. Mother stabilized, both alive, both healthy. Returned to Marja village. Lena came with Miriam and the baby. Baby in arms, Miriam strong, recovered. Village square. Layla was there. Miriam had preeclampsia, Lena explained. Serious pregnancy complication. Blood pressure 160 over 110. High protein in urine. Layla said everything's normal, but it wasn't. If I hadn't treated her, Miriam could have had seizures, gone into coma, died. Baby too. But I did emergency C-section, both saved. Miriam stepped forward. Layla said give birth at home. But I had headache, swelling, vision problems. Lena said this is deadly. Took me to hospital, saved me and my baby. The villagers looked at Layla. Silence. Layla went defensive. But I've seen hundreds of births. I'm experienced. Experience isn't enough. Lena spoke calmly but firmly. Modern medical knowledge is needed. To recognize preeclampsia, you must measure blood pressure, do urine tests. You didn't, and Miriam almost died. The village elder turned to Layla. You will no longer assist births here. Layla tried to object, but no one listened. She silently packed her things and left. 2-0. Lashkar Gah village, population 500. Nadia's clinic was traditional healing. Nadia, 32 years old, from a traditional healer family. Herbal medicines, natural treatments, energy healing. Zero modern medical training, but she was the most dangerous because she was the most convincing. The villagers had trusted her for generations. Her family had been healers for 3 generations. Lena came with chronic cough, 2-week complaint. Nadia's examination was ritualistic. Pulse check, tongue examination, energy sensing. Then she prepared a special herbal mixture, various plants, boiled, strained. 3 times a day, Nadia said. It will balance the cold energy in your lungs. Lena took the mixture, examined it. Harmless, but useless. The real patient was 5-year-old Omar. 1 week of fever, coughing. Nadia had given herbal syrup. He'll recover in 3 days. But Omar hadn't recovered. He'd gotten worse. Fever had risen to 40 degrees. He was struggling to breathe. Lena examined Omar, listened to his lungs, rales, rapid breathing, retractions. Pneumonia. Bacterial. Omar has pneumonia, Lena explained to Omar's father. Lung infection, serious. Needs antibiotics. IV, strong. Herbal syrup doesn't work because this is bacterial infection. Only antibiotics can kill bacteria. But Nadia said natural treatment. Natural treatment works for some things, but not bacterial pneumonia. This untreated causes respiratory failure, oxygen drops, brain damage, cardiac arrest, death. I must take Omar now. The father hesitated. But Nadia. Our family trusts her. Lena let the father listen to Omar's chest. Here. Rapid breathing, difficult. Lungs full of fluid, getting worse every hour. Please, let's not waste time. The father nodded through tears. FOB Sentinel. Pediatric intensive care. Omar was admitted. Oxygen saturation 89%. Low. X-ray. Bilateral pneumonia. Severe. 4 antibiotics, Lena ordered. Ceftriaxone and azithromycin, oxygen support, fluid resuscitation, close monitoring. The first 24 hours were critical. Omar's fever dropped. Oxygen levels rose. Breathing became easier. At 48 hours, Omar was sitting, talking, eating. At 72 hours, he'd recovered. X-ray clear, lungs open. He can go home, Lena said. 7 days oral antibiotics, then checkup. But danger is past. Return to Lashkar Gah. Lena came with Omar. Omar was running, playing, healthy. Village square. Nadia was there. Around her, 50-plus villagers, the largest crowd because trust in Nadia was deepest. Omar had pneumonia, Lena began. Bacterial lung infection, serious lung infection. Nadia gave herbal syrup. 1 week. Didn't work because bacteria don't die from herbs, only from antibiotics. She showed X-ray films. These are Omar's lungs before treatment. See the white areas? Infection, fluid, bacteria. These are Omar's lungs after treatment. Clean, open, healthy. She turned to Omar's father. Tell them who saved Omar, Nadia, or me. The father stepped forward. Nadia gave syrup for 1 week. Omar got worse. Couldn't breathe. Lena treated for 3 days. Omar recovered. Proof is in front of us. The villagers were silent. Truth couldn't be denied. Nadia stood. Her voice trembled. But my family, for generations, we've always... Her family did traditional treatment, Lena interrupted. And for some conditions, it worked. Simple illnesses, minor wounds, stress. But modern diseases are different. Bacterial pneumonia can't be treated with traditional methods. Preeclampsia, appendicitis, these require modern medicine. She turned to the village elder. I respect traditional medicine. It has value, but it has limits. And if we don't accept these limits, people die. In the previous village, a girl died. Appendicitis. Amira couldn't treat her. In Marja, Mariam and her baby almost died. Layla couldn't treat them. Here, Omar almost died. Nadia couldn't treat him. But I treated them. All of them. Because I know modern medicine. And now they're all alive. Silence. Long, heavy silence. The village elder stood. He looked at Nadia. You have good intentions. I know your family, but Lena is right. Modern diseases need modern treatment. You shouldn't only offer traditional treatment anymore. You must send serious cases to the hospital. Nadia bowed her head in tears. I understand. 3-0. 14 days later, Lena returned to FOB Sentinel. Colonel Webb met her. 3 frauds, 3 villages, all stopped. Civilian patient numbers increased 73%. Intelligence reports flowing again. And more importantly, local trust has returned. How did you do it? Major Chen asked. No diplomacy, no weapons, just medicine. Lena shrugged. It was simple. They talked. I showed proof. Zara, Mariam, Omar, all alive. Amira, Layla, Nadia couldn't treat them. I did. People see results, not words. Propaganda is powerful, Chen added, but real medicine was more powerful. Truth is always more powerful, Lena corrected, as long as proof is shown. 3 weeks later, new mission. Different region, Webb explained. This time 4 men. They've had veterinary training, treating humans. Lena examined the file. Veterinarians? Yes, they've treated dogs, cats, sheep, now humans. And locals trust them. Lena closed the file. When do I start? 48 hours. Enough. 4 veterinarians, 4 villages, 16 days. They know animal anatomy. I know human anatomy. We'll see which is more suitable for treating humans, because that was Captain Lena Harlow's job. Unarmed warfare, propaganda versus truth. 1 life, 1 patient, 1 village at a time. And truth always won, as long as proof was shown. If you enjoyed stories where truth defeats lies through undeniable proof, subscribe to Shadowed Glory Stories.